probably great. We're going to switch gears here for the second half of the show because I've got a very, very informative guest with us. His name is David Liu. He's a doctor, and he wrote this book, Stay Healthy, Live Longer, Spend Wisely. See it right there on cam. Basically, this book will tell you how to go to your doctor and get the proper diagnosis and treatment that you need so that you are not misdiagnosed, and so that whatever ailment you have doesn't fester and perhaps affect the longevity of your life. You know, Dr. Liu, welcome to News Talk Online on Paltalk.com. I got to tell you, you're a doctor, and you're basically breaking all the rules because, you know, that white code of silence, you kind of break through it because you acknowledge in this book, sir, that on the average, when you walk into a doctor's office or when a person walks into a doctor's office, within 20 seconds of you telling that doctor what your problem is, the doctor's looking at his watch and interrupting you. They just don't have the time anymore, at least here in the United States, with the kind of managed healthcare that we have or unmanaged healthcare that we have to give me, the patient, the kind of attention that I need in order for me to get the treatment that I need.
I agree. I mean, this is not any new information. Anyone who's actually been to a doctor's office before. That certainly is a major pressure, as doctors are kind of reimbursed by volume instead of quality of care. The other thing is doctors, since they do see patients so often, they kind of can jump to wrong conclusions because they think they're hearing something with partial information, when in fact if they asked a few more questions or let the person continue speaking, they would actually get to the right diagnosis. So one of the keys is how do you prepare yourself and set yourself for a very what seems to be shorter and shorter office visits to make sure that your doctor has the complete information he needs to get the right diagnosis for you to avoid unnecessary tests.
And I will say that the first qualifier of the book is that you use the pronoun he rather than she, just for consistency's sake, although you recognize that there are many female doctors and there are more women in medical school in the United States now than men, and I understand you're married to an oncologist, right?
That's absolutely right. In my alma mater, the University of Connecticut, I think the current stats is 53% of the entering class are women. Certainly, this is a profession unlike other professions where women are becoming more of a part of the workforce.
I think it is too, because I think a lot of women, for obvious reasons, sometimes feel uncomfortable going to a male physician. Do you find that, by the way?
Absolutely. I encourage all my female patients, if they would rather see one of my colleagues who's a female to do the pap smear or breast exam, I'm all for it. What matters to me as a physician is not who delivers the care, but rather the care has been provided for.
So you're not too nice to the medical insurance system here. In fact, I'm going to throw out the figure. I may be off by a percentage point or two, but I think you said 83 or 85% of claims that are or are not paid, and you get a bill, whether it's from the insurance company or from the hospital, there's an error in there.
I mean, the healthcare industry, that's just one part of the healthcare industry is not doing as well as it could be. Yes, there's about an 85% of hospital bills sent out had some sort of error in it. What's actually more interesting is the fact that healthcare insurance is not the same. Another that we talked about in the book is 83,000 Americans die annually prematurely because certain preventative things aren't done, like mammograms, colon cancer screening, blood pressure control, vaccinations for children. And the tragedy here is that if they had all been enrolled in the top 10% of health plans in the country, these deaths would have been avoided, and they'd be alive today. So
in one respect, you know, it's important to do preventative maintenance on your body. You suggest that, for example, men at the age of 50, perhaps even younger, if you're African American, should go in for prostate screening, I believe, right?
That's absolutely correct. And the challenge is... Go ahead.
But you also suggest that it's not necessary always to go to the doctor, and that's not necessarily a guarantee of good health care.
That's actually right. The challenge is multifactorial. One is that we know in this country that we only provide the needed care, the preventive care that everyone would agree on, mammograms, say colon cancer screens, vaccination, only 55% of the time. So that's one challenge. And the other challenge is how, right now with healthcare as it is, more individuals are asked to pay more for their coverage, are asked to get high deductibles. And do they have the information they need to make the right choices? Because let's say you're a 55-year-old man who's otherwise well, will you remember to go and ask for a prostate exam and for prostate cancer screening, which is the second leading cause of cancer among men? Or will you ignore?
Yeah, but shouldn't my doctor be recommending it to me? I go to my doctor and he says, Gary, you're 56 years of age. Have you had a prostate examination? And I say, no, I'm not really into, I'm a little, I mean, that's why guys don't have it. Let's be honest about it. They don't want it. I mean, it sounds like it's an extremely painful thing to go through, and they don't do it. And isn't it my doctor's responsibility to say, hey, Gary, be a man, toughen up, you got to do this, because the alternative is potentially death?
I absolutely agree. I think the challenge, again, is a couple of factors. Number one study showed that for a regular primary care doctor who's got a full-time practice, it would take him a full day above and beyond what he's doing just to see people, to counsel them all the preventive tests and procedures they need to stay well. The other question is, as people are forced into paying for more of their health care with higher deductibles and higher copays, will they simply skip tests because they just don't know? Will they skip tests because they don't think it's necessary? And that's the question going forward. Is this country going to get worse with health care as more people are forced into paying more and then maybe skipping care, not understanding that there are some things they need to do to stay well, to be around?
Dr. David Liu, Liu, MD, is our guest today. Stay healthy, live longer, spend wisely, making intelligent choices in America's healthcare system is the name of the book. And we're going to get to some of your calls in just a second. And you can talk to him about the specific issues that we're discussing here or any other healthcare questions I'm sure he's well qualified to talk to you about. But I want to just tell you, having read this book, it is eye-opening. There may be things in here that you already know and are and common sense, but frankly, a quick read of this book, and it is an easy read. Look how it's all laid out here. Pretty easy to read, actually. Could save your life. It absolutely could save your life in making decisions. And one last question before we go to the callers, because there are a number of them in queue waiting to talk to you, Doctor, is that you suggest in this book that a person who has even the most minimal amount of health care that he or she can afford could save themselves from financial ruin should they undergo some kind of catastrophic illness or injury.
Absolutely. I think one of the misconceptions about health is that we all have good health and will be here for a long time. One of the things I like to say is, with one of our best chance of making money is actually having good health. That's the most likelihood. If you're healthy, you can make more money. But the converse isn't true. If you have a lot of money, you may not necessarily be able to buy good health. And so as long as people understand and take charge of their health, and this is where doctors are too busy to provide that information, as long as they know what they need to do to stay well and do that, they're more likely to keep well and stay healthy.
And the thing is, and we're not going to be able to get into all the details. I'm sure Dr. Liu will be able to answer some of your specific questions, but there are certain ways for you to approach your doctor. Certain things that you should say. You should be prepared when you walk in